Hi, my name is Dr. Shirley Cheong. If you're considering implant, there are certain criteria that we need to screen to see if you're a suitable candidate. The number one thing that I would look for is the position of that missing tooth, whether it is a front tooth or a back tooth, because the decision making of replacing both is quite different. Number two, that I will look for your existing bone that's left after the tooth is being removed. These days, the standard of care is called a 3D cone beam CT, that we can analyze the cross-section of the jawbone so that we can avoid any vital structure and put the most suitable size of implant. Yes, we have our cone beam CT here, so all it takes is a 14-second scan. Then we can easily focus on a small field of view in order to analyze that area specifically to let the implant be placed.